listening to reports across is quite worrisome, but listening to Dr. Ekwazu and Dr. Aliyu, quite encouraging there that Nigeria has not slided into a second wave and steps are being taken to ward off this. So, comparatively, are you worried, given the fact that Dr. Aliyu has emphasized the fact that every Nigerian, everybody across the board should take responsibility? Dr. Ekwaji just talked about the fact that people should check their travels, mostly out of the country, foreign travels. And as at yesterday, the chairman of the Presidential Task Force on COVID-19 emphasized that even during the Yuletide, people should check their travel except very essential travels. So what's your own contribution to this?
Well, thank you. I will just like to say that as compared to the last two speakers, I am very worried. I'm very worried because the data on which we are basing our, assumptions and some conclusions are not really solid ones. If the number of samples or number of people who are testing is going down, so also the positivity or the incidence rate you'll be seeing also will be going down, but that doesn't reflect the actual situation on ground. And this is why we're worried. I'm worried that unfortunately, even though there are more laboratories now, there are more active laboratory capacity to do the testing. But unfortunately, the samples coming from the states, the activities in the states are low. So the NCDC can even do nothing except they get, full cooperation of the states. Unfortunately, if you see some daily reports from the NCDC and you follow up, you will see that the states actually reporting out of the 36 states are below, 50%. So at times 8, 9, 15. And so on and so forth. So you can't use information from those states alone, and those information are not even very complete, and you think that, we are not there. We don't know what is happening. In short, I would say, with the information we have on ground, we don't know whether we are still in phase 1 or sliding into phase 2 until we ramp up our testing capacities and we get the states, to do more. And we expect the states to do more because the federal has done very much. They've given them a huge amount of money, 100 million initially to help them to build capacity, their lab capacities, their capacity to do contact tracing, and their capacity to enhance their surveillance. I don't think this is commensurate with the funds given. Additionally, I'm aware that some 1.something billion have been given to even increase their capacity to do risk communication, to do more other activities. So the federal alone can't do what it takes to get this virus out of our society. Then secondly, I'm so worried that we might not yet be in that so-called second phase, but it's imminent. Because my worry is not those Nigerians traveling out, but Nigerians coming in for Christmas in particular. Next few weeks, the number of Nigerians that will troop into this country from countries that are now having serious upsurge of COVID-19 will be overwhelming. And this could be, what could break the camel's back. I think this is the time we need to fortify our response activities, our surveillance activities, and put in place those mechanisms that can help us contain the spread of this virus in our society. Unfortunately, on ground already, solidly, is the community transmission of this virus. Then we also have clusters happening. And I'll give you an example. If we're thinking, things are okay, are not going to this in where having low cases, deaths are low and all this, we could be taken by surprise by this virus. In the last 10 days, Sudan lost 7 doctors. Sudan is amazed and devastated. And already South African cases, daily cases, are increasing and doubling. Already they are reaching 2,000 cases a day. So there are already, focuses or clusters in Africa that are becoming very hot spots following this upsurge in countries that we like to go or countries that we have our compatriots living, and they will come to visit us, you know, in this December. So we shouldn't be thinking that we are not yet there. We are doing well, but this is federal alone can't do it. The states have to really rise to the occasion. The governors have a lot to do to save Nigeria. And the last point is, it seems as if the people in the country, our people have, you know, thrown their masks in the basket, into the basket, and thinking that, oh, this thing is no longer there. You go to, you know, areas where you see human gatherings, mosques, churches, where there are weddings, etc. If you are wearing your mask, it's like you are from the moon, and so on and so forth. And our super spreading activities and groups are not just like the European ones or American ones, etc. For instance, where we have lots of people in Africa, what spreads this virus more is the way we behave. We yell, we shout, we don't talk slowly and all this. And these are things that make the virus actually spread. So these few things I've mentioned, coupled with the fact that people are not following the you know, preventive protocols anymore, and we are just saying, please don't be fooled. It's not yet over.
Or John Toyegbide, as much as we see breathtaking, mind-blowing upsurge from other climes that are people will even say are more sophisticated than where we are, a lot of Nigerians are still in disbelief regarding the reality of COVID-19. What are your comments?
Well, thank you very much, Omini, for that question. There's no doubt that some of us are really very concerned because COVID-19 is actually no play. And if we see what is happening in other parts of the world, especially America and then parts of, you know, Europe, whether call it second wave or third wave, Nigeria cannot totally preclude herself and feel that is actually immune on that. As has been alluded by, you know, Professor Nasser Sidi, my greatest worry is that, you see, things should be done scientifically. You don't just come out and say, all is well. We all know that for any disease to have been declared, you know, a pandemic, you have to use certain indices that will help you make your statement that, yeah, you have achieved this level. And even then, you don't go back to sleep. We talk about, you know, herd immunity. Ask the question, have we really attained, you know, the herd immunity in Nigeria? Or what are the steps that we've worked towards that? It's only when we attain herd immunity, and that of COVID-19 is estimated that 50 to 60% of Nigerian population must have been vaccinated or immunized or might have acquired, immunity against this disease. These are the loops. So, number one, we really have to bump up or increase the number of, testings. That is the only way. If we test it, and then from that data, we can confidently say that this is the direction where we're going. Number two, sustainability of enlightenment, public awareness. You talk about the non-pharmaceutical interventions. People have really almost, forgotten some of this. I must applaud, the efforts of the Presidential Task Force. A lot of education was done, plus, efforts of, the media houses. But people have really gone, to sleep. They think it is, over. Now, the third factor too, apart from what I have also described, on your personal basis, you have to ensure that your immune system is up and running. How much have we taken into this, direction? Vaccination, what are you trying to achieve? You're really trying to boost and then maintain, your immune system or upregulate, the immune system. It's very critical and very important that if your immune system is upregulated, number one, the chances of you coming down with COVID-19 or any other disease, viral or so, are less. The second, even if it actually misses and you get infected with COVID-19 or the virus and then get the disease, COVID-19, the chances of you progressing to the more serious, stage are less. This is to say that the recovery period will be shorter. But this way, you will not only save, money that you would have spent in, hospitalization of these patients, you would have also saved, lives. Because you know that most people who will progress to that critical stage of intensive unit, they don't really, make up. So, I'm saying that we should look at the data. We must have the data to really authenticate our statements to say that, oh, we've done well, and this is, the data. Data doesn't lie. Once you give data, authentic data, and we should work hard, towards that. Maybe we have some of this data, but if the public is not made aware, there is just no way we would know. So the public got to be made aware that this is what we are doing. We've tested this number of people, and this is it. Great. You had only 2, testing centers at the time of, the outbreak, and now we can boast of over 70. Fantastic. But where is the data? How many people have you tested? How many? Because if you had only 2, you are able to do 100. Then if you have, 70, just work out, the math. You should be talking to something hundreds of, thousands. And efforts should not be relaxed. Sometimes you just get to whip the hose, to get it going to the direction that you want to go. So, the federal government and those who are trusted with this, responsibility, they must work out a mechanism of generating this data, just like Professor Naside has said. The state governors, they have a part, to play. The federal government, the various, authorities or, agencies, they have to, have a role, to play. And most importantly, individuals, we must not go to sleep thinking that it is over. It is not yet over. Thank God, we were hoping, or people all over the world were, expecting that when COVID-19 enters Africa, we will be dying like, flies. Maybe by the grace of God, we did not die, but we should not go to sleep. So everybody should just wake up. This is what I have to say now. Thank you.
So much, Dr. Wide. Let's quickly go to DG NCDC. Dr. Ikwazu, before I come back to Dr. Liu, still on testing, as much as the Presidential Task Force in its national response has done a lot, and from the testimony of Dr. Liu, it says now you can test and get results within 15 minutes. We have cases of people or organizations or groups that have done tests for more than 2 months, for more than 3 weeks, and results are yet to come out. For example, a team came to the headquarters of NTA and did a test over 2 months now. We are yet to get results. What is the situation like?
Thank you very much. I don't really think that's the correct representation or representation of where we are in terms of testing. I wonder what happened with the team coming to NTA, but we can discuss that outside. But, I think the bottom line is sometimes we have to really look at the facts. We present the data of new tests and new cases in Nigeria every single night. There's no other data point in this country that is presented to the country on a daily basis. We haven't missed a single day from February this year. We put out the number of tests we do weekly. We do about 30 to 40 tests per week, about 3,000 to 4,000 per day. These tests have remained consistent through the riots, through the demonstrations, and work has continued. So there are many things that lead to testing. People have to come forward. The testing facilities have to be there. Reagents have to be there. Commodities have to be there. Everything the government is supposed to do, we've actually done. Supported the states in developing the centers, ensured a supply chain that has never broken. You've not heard that any lab has run out of reagents in 7 months, in 8 months in Nigeria. So I think a lot of credit needs to go to healthcare workers. And sometimes it's difficult to listen to a lot of criticism around these colleagues because they've been working very hard for 10 months, making sure people get tested, getting their results to them. If there are individual failures here and there, maybe there's a particular problem. But really, the organization that has gone into ensuring that tests are available to Nigerians has really been incredible. Let's think about what happened 3 weeks ago. We were about to open NYSC camps in Nigeria, right? NYSC hasn't happened for close to 6 months. They had to delay the reopening. We worked with NYSC together for months to prepare for this. We reopened NYSC camps safely, tested every single person that came into those camps, whether you're a youth corps or a camp community. Over about 40,000 people were tested. We found about less than 200 positives, so less than 0.5% of what would really be a random selection of people coming to camps. So yes, we may not be where we want to be in Nigeria collectively, right? But it's not the responsibility of one organization to solve all of that. We, as a society, state, government, federal institutions, all of us have to work together to improve the situation. But let me end by saying this. When you have data, it's not just the testing data that's important. You triangulate the data across many data points. So whether you look at hospitalization data, at the peak of the outbreak, our hospitals were full, treatment centers were full, at least in certain cities, in Lagos, in Kano, in the FCT. Now, these centers are more or less empty. They have a trickle of patients coming in. If you look at our call center data, the number of people calling our call center every day that they are ill, requiring evacuation, that has also reduced dramatically. Why am I saying all of this? Yes, we by no means want to assume that we're finding all the cases in Nigeria. By no means. But, we've worked very hard to respond to this. The fact that the curve is heading south is not a miracle, right? It's as a result of a lot of the hard work that has gone into the response. And I think we have to give credit where credit is due. Now, moving forward, nobody in the Presidential Task Force is being complacent. We still meet every week. We address the press. The messaging has been consistent. We have just completed this week another distribution of personal protective equipment to every state, every FMC, every teaching hospital in Nigeria. So we have never stopped, and we will not stop this response until the country is safe, until we can distribute vaccines that will enable us start a return to normal life. The planning for that has already started by the relevant arms of government, pulling together all the stakeholders. So, in summary, my point is that, listen, we've been through a tough year. Everywhere you look in the world, countries are struggling. But not every country is having a second peak. Cases are coming down in India. Australia has just gone through a period of not having a single case for a few days. Many countries in the east of the world are actually seeing cases decline. So I don't think the narrative in Nigeria should be completely predicated on the second wave happening because it's happening in the UK and in the US. We must look at our efforts, acknowledge the work that has been done, continue doing that work, continue the messaging like we're doing to all Nigerians on what they can do to support, encourage our healthcare workers to continue the very difficult work they've been doing, and generally keep mobilizing leaders in our society. When people are not wearing masks in a church or in a mosque, that church has a leader. He has a leader that can hold them responsible. If people are not wearing masks in their workplace, most workplaces have a leader. So as a society, we must really hold ourselves accountable to these measures that we need to put in place to keep our country safe. And for us, on the public health side, state and federal level, the PTF, we are absolutely committed to continuing this response for as long as it is necessary. This is the mandate we've been given by Mr. President, and we will not stop. So whether we're tired or not, I'm here this evening, I'll be here tomorrow, irrespective of how tired we are. But we will not stop, because our responsibility is to get ahead of this outbreak and to keep Nigeria safe so that our economy can restart and we can restart the way of life that we enjoy in our country.
Dr. Ikwas, I'm still on you, please. Just to, you touched on NYSC, and as much as there's so much effort put in place, I said yesterday you were quoted by saying that 1 in every 200 corps member who showed up at NYSC orientation camps tested positive for COVID-19. Since the information you gave yesterday and now, where are we? Have we moved on? Have we checked it? Have we stemmed it?
So, 1 in 200 is less than 0.5%. And to clarify what happened, none of these corps members actually got into the camps because everybody was tested before they entered the camps. We deployed for the first time in Nigeria rapid diagnostic tests, antigen-based rapid diagnostic tests that provide results almost immediately after 15 to 30 minutes, depending on the process, right? Therefore, whoever was found to be positive did not go into the camp, was then excluded, isolated, either in a treatment center or in an isolation center. So it was a very successful response. We also used the opportunity to validate the RDTs, and we're now going through a process of defining other settings in which we can use these RDTs. If that validation goes well, then we have a tool that we can offer healthcare workers to use in the hospital without requiring a sophisticated lab to send samples to. So there are many things that happen on the sidelines that might not seem important. So right now we are preparing for the second stream of NYSC camp attendees. We have a third stream in January. What has happened in camps is not just testing. We worked with NYSC to redesign every youth service camp in Nigeria so that there's sufficient distancing, provided PPEs for all the camps, worked with youth health workers, so doctors, nurses, pharmacists, all the graduates that are coming to camps were basically recruited to become what we call IPC vanguards. So in every camp, we now have a collection of health professionals that are going to support the response, both in the camp and when they get out of camp. And so right now, there's a very close collaboration that has emerged between ourselves, the state government, and NYSC camps in keeping these camps safe. And these youth corps members will then be released into society, into their states, to carry these messages out of the camp and into the states where they're deployed. So it's been a fantastic effort, and a lot of credit to the DG of NYSC for his leadership, his vision, his commitment to reopening camps, because it was really becoming a problem for the country. We had youth service members that had left, and a whole backlog of young, enthusiastic graduates that couldn't enter the work stream because they had to go through this process. So we're happy that we could alleviate that challenge for the country and enable young graduates get on with their lives through a safe reopening of NYSC camps across the country simultaneously, across the 36+1 states in Nigeria.
Well, Ikwazi, we'll come back to you. Let me leave you there for now. I'm back to Dr. Aliyu right here with me. Doctor, we must say Nigeria Nigeria doesn't enter the second wave of COVID-19. But before I give you the question, let me give you a related question to what I asked Dr. Ikwazi. Just yesterday, you were quoted to say at the briefing that school schools to immediately isolate any student or people with symptoms of COVID-19 or other respiratory disease. Is there a follow-up to this? Because if we are able to check all this, just like Dr. Ekwe just said, then the chances of Nigeria sliding into the second wave will really be a difficult one.
So with schools, even before schools opened, we worked very closely with the Federal Ministry of Education to develop guidelines. And these guidelines apply not only to the public schools, but also to the private schools. And they talk about a lot of things. When you look at the guideline, it talks about the non-pharmaceutical interventions, the need for monitoring if a child comes to school, temperature monitoring, availability of hand washing, etc. But one thing that didn't really go out very clearly was something that we all know even before COVID started, which is if your child is sick, do not send the child to school. Because even before COVID, if your child is sick and has a cough or has a bad cold, the last thing you want is for the child to infect everybody else in the class. So this is standard advice. But one thing that was obvious when I visited some schools in FCT to inspect just when they were in the process of opening, and I had discussions with the teachers. And one of the things that was very obvious was actually it didn't occur to them that they also had a responsibility while they are working as teachers to make sure they spot a child that might be sick, and to exclude that child. Because with respiratory tract infections, it's not just COVID. You can pick up other viral infections. Okay. If you recall when we started off with the COVID prevention campaigns, etc., one thing that was very obvious, even when you ask people in public, you'll ask somebody, when was the last time you had a cold? People stopped having colds because it's the same protective measure. If you keep your physical distance, you wear a mask, you sanitize your hand, you sanitize your surfaces, it's not just COVID that you are protecting yourself from. You're also protecting yourself from other infections. So the message really to teachers is they also have a responsibility together with parents. If a child is sick, has a fever, or has a respiratory tract infection, has any presentation that might suggest an infectious disease, don't send the child to school. Hold the child back and make sure that the child is taken to care where they will be properly assessed in a hospital, and if there's a need to be tested, etc. It's one of the most effective ways of preventing transmission. Now, while we're talking on that, I just wanted to briefly re-echo the issue that DG talked about, DG and CDC, with regards to travel. Because I know NTA International will also take this up. 2 or 3 things that our fellow Nigerians and those outside the country need to know. Wherever you are, the message from the PTF is stay where you are this season. We don't want to have a surge in passenger traffic. We know what is happening outside the country. We don't want re-importation of COVID-19. More importantly, we are monitoring the situation very closely. If you do not want to get stranded, because if things deteriorate, we could close the airports at any time. So if you do not want to have a travel that will be so memorable that you've been stranded either outside Nigeria or within Nigeria, it's better you stay where you are, celebrate the Yuletide with your family or Zoom in. But COVID is still very much around with us, and we prefer not to be importing new cases. Don't be stranded. Stay where you are. There will be other opportunities hopefully next year, especially as the vaccine comes in. Yesterday, as I said, once the vaccine comes in, hopefully all these travel-related issues will be sorted. The second thing I wanted to mention is the portal. We're going to continue enforcing the use of the portal. So for those people that have to come, essential travel, etc., please make sure you go onto the portal, you register yourself, fill the health questionnaire, upload your COVID-19 PCR results that must be negative within 5 days, and also pay for a COVID-19 PCR test at day 7 on arrival. And be sure that you're not coming to Nigeria for a short period of time. There's nothing like short-term visits, because if you come, we expect you to self-isolate for 7 days.
Quickly, before I go to Professor Nasidi and Dr. John Tuadigbe, now, from what you have said, quite impressive there, but implementation is key here. What is the PTF doing to work hand in sync with the embassies, work hand in sync with the airlines, work hand in sync with the airport authorities? Because if PTF or the national response is targeted in this direction, And the supporting agencies, the airport managers, the airlines, the embassies across the world are not working hand in sync with you. It could relapse.
So the PTF has already directed the Honorable Minister of Foreign Affairs to put in a communication to our embassies and high commissions outside Nigeria. So that message is already out, and there's a very clear message that has been sent out through the Honorable Minister of Foreign Affairs. So that in itself is being done. The airlines are being fined. We will fine them $3,500 US, and they know this, for any passenger they bring in without a negative COVID-19 PCR result. Either the PCR result is not there or it is positive, because we've had a few cases where people have come in with a positive result, or they have not cared to check. One of the things on the portal is the need for a QR code, which is a sort of barcode, which is now going to be a permit to travel. We haven't made that absolutely mandatory because some people have challenges with using the portal depending on where they are in the part of the world. And we've worked very hard on this. We're very confident it works. But even if you have just 1 or 2 people being denied travel simply because they don't have that QR code, then that's not fair. But we are going to put in place enforcement. We have mentioned this before, right from the beginning, that if you come in country and you do not follow our protocol, you do not go for a test at day 7, and that testing requires payment. If you do not go for a test at day 7 and we pick you up by day 14, I already have a list of 300 passengers that have failed to do the testing. We're going through the list of the 300 and pick 100 because we'll be contacting them to find out why they haven't had a test. And if it is very clear that this is deliberate, we will place them on a travel restriction list for 6 months. So if we enforce that, because the problem is really with enforcement.
But it could be that they are evading on grounds of affordability.
I would argue no, because remember, we have exceptions. So for instance, if you are a deportee, we don't expect you to pay for the test. It will be done free of charge. If you are somebody who was brought in and paid for by, let's say, you couldn't afford your travel and you were either assisted on humanitarian grounds, etc., you don't pay. Diplomats are excluded. Children below the age of 10 are excluded. But Omini, if you can buy a ticket for $700 US to travel, then that responsibility for paying for a travel test lies with you. It lies with you.
Let me hold you and go to Professor Nasidi and Dr. Tor. I want to leave this question to the two of you, but beginning with Professor Nasidi. Now, if you take, let me say, a rough stroll across public places, FCT, states, local governments, even in the rural communities, e.g. rural communities, if you arrive some rural communities with your face mask on, you look odd, because to them, this pandemic is about the cities. So you are left with no option but either you play along with them or you remain odd. You go to most public places except for maybe malls, but markets, motor parks, the streets, so many, even some public institutions. Enforcement and compliance with the basic protocols of hand washing, using sanitizers, and either medical face masks or non-medical face masks has remained a problem. What advice will you offer, beginning with Professor Nasidi? Let me begin with you.
Well, actually, this is a mixed tragedy that our people are running away from these simple, tools that can save their lives. And just for me to go out of Nigeria a little bit to see what happened in a very powerful country like the US that have all the gadgets, high-tech medicine, high-tech communication, information, etc., and so on and so forth. Here, what plays a key role, as had been mentioned by Dr. Chikwe Hekwazu, is issue of leadership. If there is miscommunication right from the leadership, then the community will pay dearly for it. In the US, states that, or communities that ignored the call by Tony Fauci and his group that please wash your hands, wear your masks, keep the social and physical distancing, and listened to your experts, were saved. Those who refused to listen, are now paying dearly for it. And the country is in the second wave. I pity those who don't want to be using these simple mechanisms that can save their lives and their families. One thing that we have to admit is that we have not actually empowered that risk communication activities in Nigeria as we should. It's a little bit weak. It's one thing to have the institutions on ground. It's one thing to have the labs. It's one thing to have the, communication facilities. But you just talked not long ago that implementation and empowerment is what is very crucial. I can give an example. Just 2 weeks ago, I went to the mosque, and I tried. I wore my mask. I had my hand sanitizer, and we were three. We tried to keep that space at least 1.5 meters, and we were like aliens landing from the moon. We kept struggling and struggling to see if we could actually maintain that distance. Of course we couldn't, and almost 80% of those around us were not using the mask. So that is in an urban area, in a capital city. If you go to the rural areas, if you even see anybody with a mask, the mask is on the chin, not on the mouth, not on the nose. And now what Africa will keep praying for is that this virus does not come, and take us by surprise, as I mentioned earlier. Because if it does, then two things are happening. We are weak on the risk communication to devastate the communities. We might not be able to have easy access to the vaccines, despite all the sweet talks. I was a member of a WHO high committee during the pandemic flu, and was even the chairman of the technical working group for the globe. And we had a terrible experience when the vaccines against the H5N1 and H1N1 became available. Africa was the last to have access to those vaccines. And I want to put it on ground that nobody should be fooled to think that when these vaccines become available, we are going to have easy access. The WHO and others are going to work for us to get us the vaccine. These big countries that are manufacturing those vaccines will not make it available to you until their people are virtually, at least they are attaining the, what do you call that immunity?
Herd immunity.
Herd immunity. Yeah. So we shouldn't be taking chances. A country like ours that with large population should be a little bit more proactive. So believe me, Omini, the issue of wearing mask, observing these preventive measures that have been propagated by the PTF, by the, the national response to COVID-19, is a life-saving thing that I am calling on all Nigerians. Don't be fooled. Don't think that this thing is no longer there. Even if it is not there, make sure that it doesn't get you. Just protect yourself. Then the key and one of the most important aspects of getting this to be done is to hold the leaders of communities, of organizations responsible. If we can do this, it will work. Today I went to a pharmacy, a very famous pharmacy in the town, and I was shocked. I was there with a foreigner, I think a Swiss or somebody like that, and we observed that out of the entire staff in that pharmacy, only 2 were wearing masks. And virtually 50% of them were shouting and yelling across the tables or the whatever. So the situation is bad. The situation is not something that we should play with. I believe if at all the PTF wants to save Nigeria, the best vaccine we have so far is to continue drawing the attention of Nigerians that it is not yet over. Please, let's go back to using these mechanisms that can save our lives. I stop here.
John Towagbide, quickly before I go to Dr. Ikwaju and we'll take our first report. Now, from what Professor Nasidi has enumerated or expounded on, it clearly tells you, besides the agencies, besides the government, as individuals, we should take personal responsibility. What can you say about this?
Thanks, Omini. There is no doubt about that. The truth is this: as individuals, we must, not that we should, take personal responsibility. But attitude is something which needs to be checked. In most places, the world over, just I will give some examples. If you are in the United States, if you are to survive there, you got to obey the speed limit. If you don't do that, the cops are behind you. Who are the cops? The cops are actually the government. Because human behavior needs to be regulated, even in advanced countries like that. For several years that I lived outside, I never had a ticket because anytime I was driving, I felt that there was a cop right behind me. And that's how I survived. So, that is on the personal responsibility. And then individuals, we must take what I call corporate responsibilities. I give an example. Last week, Saturday, I went to one of these, superstores, to buy a refrigerator. Honestly, nobody will get into that store if you were not wearing a mask. I was highly impressed. Now, I turned around, went to other places. It was a party for all. Everybody was just mingling. So, as far as I'm concerned, I've given this example of that store that enforced wearing of the mask. Human behavior is such that, in fact, let me also give a story of my late uncle. He told me, this was several decades ago, that, look, John, my son, if there was no law that is enforced, you cannot move from point A to point B. That is how they used to. If you are just alone, they will just get you and then trap you, and then you go on slave trade. So, back again, in as much as we're talking about, individual behaviors, then corporate, behaviors, government should also step up and be serious. We've had some incidents where in this country, we don't want to look back, but everybody knows what I'm talking about, where clearly things, non-pharmaceutical interventions were actually flouted at, public, places, involving very high, government, officials. And I'm saying this with all due respect. Sometimes, not sometimes, you have to lead by example. If I see, or just, this is me, who is even conceptualized, somebody who is saying, who is actually giving that mandate, that he should enforce people not to go without mask, going without a mask, I'll think twice. Talk about somebody who is less, privileged. So let's lead by example. Individuals should also get up and know that if you don't do this, nobody is going to do it for you. And you die once. This is what I say. COVID-19 is actually real. On the other hand, I've continued to hammer this message. Most countries, they also, in addition to vaccinations and other non-pharmaceutical interventions, they are looking for ways of getting their people's immune system up and, running. You have several of these, nutraceuticals that we've known to actually boost our own, immune system. We can go a long way encouraging people. Government can even subsidize those. There are countries where you go now, you cannot find vitamin C because it is known to be actually immunomodulatory, and then you have so many other things, zinc, and then the rest of them. So government should also make this part of the palliative to the people, that the population is well immunomodulated. That's what I would say.
First tonight is preventing the second wave of COVID-19, and so far, if you are listening to the program, it's not just about the health authorities, it's not just about the Presidential Task Force, it's not just about the health experts or NCDC or other concerns or media houses. It's about you as an individual. Take responsibility. We have a couple of reports, and when we come back with those reports, we sustain the conversation, we take tweets, and we take phone calls. The first report tonight will be coming from Lagos State.
9 months since COVID-19 found its way into the country, Nigeria has gone through several phases of the pandemic. The peak period, a medial phase, and then a gradual reduction in infection rates. Before now, the quick spread of the virus heightened uncertainty about how bad the situation could get, and so government locked down the city of Lagos, the epicenter of COVID-19 in the country. Financial houses, private and public businesses, markets and other corporate and social events were halted. Everyone learned to work from home and observe safety protocols. The restrictions yielded results and new cases declined. The figures dropped from 664 cases a day in July to below 300 cases sometime in August and 79 cases on September 13th. Even Lagos State reported less than 10 cases in one day. This success is largely attributed to aggressive measures taken by both federal and state governments. The total relaxation of restrictions was announced to hasten economic recovery. The move, however, came with a caveat. Safety regulations must be strictly observed. But Nigerians seem to have let their guard down. Hands are no longer frequently washed, face masks are almost forgotten, and social distancing seems to be ancient history. How about the recent large gatherings of youths with no recourse to COVID-19 guidelines? Well, the 255 cases of COVID-19 recorded in Lagos on the 8th of November show that a spike in cases has begun, and experts say the nonchalance of some Nigerians could cause a setback for the nation.
If you look at the Lagos State Epic curve, for those who have access to the NCDC site, you would notice a rise occurred, and there was a sharp rise mid-October. There was another sharp drop, followed by a very major spike between early November and now, let's say within the month of November.
Government needs to do a lot more to drive this sensitization exercise and ensure that there's some level of stricter compliance with the measures.
Government is re-echoing the need for adherence to safety guidelines to prevent a second wave, which could be disastrous.
Quite disturbing there, but if we take personal responsibility, then we'll avert all that. Quickly, we go to Kaduna for the next report.
The outbreak of coronavirus early this year in Nigeria and the subsequent lockdown have affected social and economic activities. Schools, markets, financial institutions, hospitality industry, and social centers were not spared. Among measures taken to curtail the spread of the virus was the imposition of interstate travel ban. Musa and Ifanyi are among many traders at Sheikh Abubakar Mahmoud Gun Market who suffered the effect of the pandemic, as most of their stocks either expired or got damaged during the lockdown.
We are among those who lost their goods during the lockdown, and when the market was later opened, there was little or no patronage.
Many things are lost. I no lie for you. It passed almost to 2 point something million. I cannot really talk about that one. Anything government want to compensate us, can compensate us.
Even with the opening of the market, many traders are still counting their losses while some shops are yet to open due to huge losses.
We spend almost 5 to 6 months at home, and we leave our goods in the market. So when there is no ventilation in the shop, something must be happening. All our goods spoil, some expired.
Kaduna State government has distributed palliatives to the poor and vulnerable in the state to cushion the hardship caused by the pandemic.
The COVID-19 pandemic has exposed the fragility of our public health system. We are using the opportunity of this pandemic and the extra resources we are getting as support from donors to strengthen our healthcare system as a whole and prepare for the next pandemic by the grace of God.
Still keeping faith with the conversation, let's go to Enugu.
Like in other parts of the country, residents and people of Enugu State were caught up in the war against the coronavirus. It was a pandemic that ravaged humanity with devastating effect on virtually all economic activities in the state. Worst hit was the informal sector, comprising thousands of small businesses which constitute an integral part of the state's economy.
So we have to lock up everywhere during the COVID-19. So locking up everywhere made me to lose both my customers and the money I was supposed to realize by that time. So I just lost everything. If I'm to estimate it, it should be close to 500 and something thousand.
We are not happy at all. No, it's not breaking at all. It's just the same thing as it happened before.
Operators of the organized private sector were not spared in the ravaging effect of COVID-19. Although the lockdown, social distancing, washing of hands, and wearing of face masks appeared to be viable ways of checking the spread of the virus. At the outbreak of COVID-19 in Enugu, the state government approved a whopping 330 million naira to provide protective equipment, drugs, and establish isolation centers in strategic locations within Enugu State. The medical intervention are being monitored to boost the state testing capacity and management of coronavirus ahead of the second phase of the pandemic. The whole idea, according to the state government, is to ultimately check the spread of the virus to avoid a spike that could trigger another lockdown of the state.
Reports there from Lagos, Kaduna, and Enugu. Now back to the program, Doctor. And please, as soon as the DG of NCDC is up, I should be notified because there are a couple of tweets directed at him specifically. But before we go to other specific issues, quite worrisome. When you say national response, it means federal, states, and local governments. From Professor Nasidi's account, states have been giving huge sums of money. What is the PTF doing to monitor and ensure that the state governments are deploying these monies for the containment of COVID-19? Because it's quite disturbing that at the national level you feel the pulse, but when you trickle down to the states and up to the local governments, it becomes a problem. Is there any MREI? Are you really sure that the state governments are making use of these monies effectively?
So we have been working very closely with the Nigeria Governors Forum through their chairman and Ekiti State Governor, and also there's a subcommittee of the National Economic Council which is headed by Governor Okowa, and we meet with them every 2 weeks via Zoom. The information we have sent out to the states is very clear. In fact, just today I signed a letter to each and every state governor. When we negotiated with them, we negotiated based on an incident action plan that states these are the things that you have responsibility for. Because we all know, like when we talk about testing, just like Professor Nasidi rightly said, testing is the responsibility of state governments. It's their responsibility to set up sample collection centers. It's their responsibility to arrange for the testing. It's their responsibility to follow up if the test is positive and also do contact tracing, etc. So we said to them, you need to improve on testing. Set up a sample collection center in every local government. We've just recently said to them, we want you to test at least 450 persons per local government over the next few weeks. because that will put a lot of the states onto the 1% target that we are looking at. Okay. We've asked them to invest on risk communication and community engagement. So jingles, visiting markets, talking to market women, talking to people on the streets, providing information, ensuring that there is good communication with community leaders and engaging them. We gave them ₦1 billion for that based on the incident action plan. We gave them a clear-cut plan, which we worked out with them. And my appeal to the state governors is, yes, we know you haven't spent this money. We know that you haven't spent it on things that you are not supposed to. But don't keep the money. The money is not there for you to just keep. The money is there to fund the incident action plan and improve your COVID-19 response. So please release the money for the purpose it was meant for. There's monitoring.
Did you give them a timeline?
So, of course, well, COVID, it's a pandemic. So what timeline? It's an emergency. So there's no timeline. It's immediate. It's now. Yes, we can understand some of them are being cautious, making sure that there is accountability, which is excellent. But one of the reasons why the Nigeria response has been effective at the federal level is because we have not shirked in taking action where there's a need to take action. It doesn't matter whether your decision at the beginning is right or wrong. Don't delay taking a decision. So also don't delay holding back on these resources. These resources are needed by your emergency operating centers and by your state task force teams to deliver and make sure that we improve on testing, we improve on surveillance, we also improve on risk communication and improve on infection prevention control. We have practically given you the things that you are supposed to do. So please release the funds for the purpose they are meant to. We are grateful to about 4 state governors. They've actually moved the money from their federal allocation accounts to a dedicated COVID-19 account, which is the first step in terms of ensuring accountability. We have a monitoring mechanism, which is through the Nigeria Governors Forum, which will be monitoring the implementation and how they're doing. And we're already starting to get results. And some state governments have been very good. So please, 1, release those funds. 2, make sure that the information you are sending out, the body language you are providing to your citizens in your states is very clear. A situation where state governors are attending mass events without a mask sends out the wrong message. It sends out the wrong message. Some countries, if you look at the countries that have done badly in terms of COVID, and I'm not going to mention those countries, we all know them. Yep. One characteristic is that the leaders have given mixed messages. Their body language suggested that COVID is not a problem. And that has been read by the citizens and they have followed suit. In Nigeria, we've been very lucky. President Buhari has given us all the support. Our PTF chairman, the SGF, has been very consistent in his messages. And we've been sending out the message consistently, just like DG NCDC said. This thing is not over yet. We have given you resources. The federal government is doing whatever it can to make sure we don't have a second wave and to make sure that we do not have unnecessary deaths. But no responsible government will sit down and see its citizens dying of a preventable disease and not take action. People should remember what happened in April in terms of lockdowns, etc. We don't want to go back to that situation. But if things do not work, no government will sit down and say, actually, nothing is on the table. Everything is still on the table.
Okay. Well, let me just appeal to Professor Nasidi and Dr. John. I'll be with you shortly after the break. There are a couple of tweets here directed at Dr. Liu, and there are also tweets directed at Dr. Eyekwazu if he's back. Let me quickly address these tweets and you take them before we take a break, then come back to Professor Nasidi and Dr. John. Now, the first one here says, why do we still have less than 50 states reporting on testing in spite of the huge resources given to them? Each state has received at least ₦1 billion, just like you said, to ramp up testing and response to COVID-19. The next one says, since the PTF ceded enforcement to the states, what is its rating of enforcement and what is the wave out to prevent a second wave? What went wrong with the NCDC initiative? This is for Dr. Eyekwazu. Now, could you quickly address this? We'll take a break, then we come back and interface with Professor Nasidi and Dr. John after your response.
So the first one, I'll start with the first one with regards to testing. So as I said earlier on, it's always been the responsibility of states to arrange for testing. I mean, if today we are not wishing, but if you develop respiratory symptoms, if you call me for a test, I will tell you it's the FCT that is responsible for it. And it's always been that way. Federal government has responsibilities at the federal level, but there's a limit to how far we can go down at the subnational level. The issue with testing isn't just about resourcing and making sure that we have access to sample collection centers, etc. And we're working very closely with the state governments to make sure this happens. It's also about social acceptance of the test itself. If you have symptoms, I cannot drag you to come and have a sample taken. It's all about risk perception, and it's all about being able to assess yourself and know that you are supposed to have a test done. Yes, our risk communication could have been better, and we have certainly resourced this now right down to the community level to make sure that this happens. And we're appealing to people. If you have symptoms of COVID-19, if you have a fever, respiratory symptoms, etc., you have a personal responsibility to make sure you define what your illness is, not only for yourself, but also to protect your family members. And if you are above the age of 50, 23% chance of dying. I mean, if I ask you to cross this road and you have a 20-something% chance of dying, you'll not even be in Abuja. You will be very far from this city. So it's the same thing. You assess your risk. If you have COVID, there are certain monitoring parameters that are so critical because we know people can die suddenly. So like the shortness of breath is a reflection of low oxygen levels. So if you have COVID, even if you are being monitored at home, you need to have an oxygen saturation meter, a pulse oximeter to measure your oxygen, to make sure that your respiratory rate is being checked, your blood pressure, etc. So it's slightly different to how you would monitor if you have malaria, for instance, because there's no specific treatment that will arrest the progress of the virus. You've got to test. The other issue with enforcement, this is all about collective responsibility. Even in the developed countries, even in countries like China, they still struggled to enforce these measures. The best vaccine available now are those non-pharmaceutical interventions. Forget about all these Pfizer, whatever, 90%. If I wear my mask all the time, if I use my sanitizer, if I avoid mass gatherings, if I'm very sensitive to my environment and those that might have COVID, I'll not catch it. It doesn't matter whether I have 2 jabs or not. So, as Professor Nasiri said, these vaccines will become available. They may not be easily available in developing countries. And secondly, there's no plan in Nigeria at this moment in time to give it to everybody. Okay. So you protect yourself based on what you already have on the ground. And these are non-pharmaceutical interventions. We hope the state governments will continue to enforce. When we had a problem in FCT, I didn't call the federal government side. I called the FCT minister to ask for a certain bar to be closed because we have not relaxed nightlife. We have not relaxed bars. In fact, there's supposed to be a curfew still between 12 midnight and 4 a.m., which people are not respecting. So,
okay, Dr. Ali, let me hold you there. Like I said, we'll take a short break, come back, take a few reports, then I return to Professor Nasidi and Dr. John. But quickly, one assurance we got from PTF is that the Honorable Minister of Health, Dr. Hanire, says the Federal Ministry of Health is taking measures towards acquisition of COVID-19 vaccines whenever available. And going by Professor Nasidi's revelation here, well, we hope that that will not happen because a Nigerian will here play a fundamental role in the vaccine production. So maybe that politics will not play. But quickly, let's take a short break, and when we return, we'll take a couple of reports, then we'll go to Professor Nasidi, and he has some revelations to make further. Stay with us.
For now, the best and most efficient way to avoid getting infected is through regular hygienic and sanitary practices, as well as social distancing. As individuals, we remain the greatest weapon to fight this pandemic. By washing our hands regularly with clean water and soap, disinfecting frequently used surfaces and areas, coughing into a tissue or elbow, and strictly adhering to infection prevention control measures in health facilities, we can contain this virus.
coronavirus is real. Steps to avoid this pandemic. Wash your hands regularly or sanitize your hands. Keep social and physical distancing. Avoid crowded places. Stay at home unless absolutely necessary. Don't touch your eyes, nose, or mouth if your hands are not clean. Avoid the spread of coronavirus. Coronavirus is real.
NTA Tuesday Live, a network issue-oriented innovation talk show.
We're taking a look at preventing second wave of COVID-19. Quickly, let's begin this segment with some reports. First, from Port Harcourt, Rivers State.
Past experiences of COVID-19 no doubt kept different segments of the economy on hold. The situation created setbacks in the school curriculum, movement of goods and services, livelihood and the economy.
During this pandemic, almost all the economic indices of this nation have been in a lull, especially the artisans, the SMEs and all whatnot. They have suffered a lot because of this pandemic.
The sales of last year and this year, trying to travel, one cannot travel and you stock money in the bank. Can't even travel to transact any business for the year 2020.
Looking at the trends in other countries, the need to take all preventive measures and increase testing centers for the virus to avert a second wave of COVID-19 in the country has been stressed.
The government can stake a claim with relevant international organizations such as the World Health Organization, which incidentally, thank God, has made the point that it would stand in the gap for developing countries as far as the distribution of vaccines is concerned.
While appraising government and private sector involvement in enlightening the public on measures to contain the virus, provision of funds for procurement and supply of palliatives and medicals, concerned citizens in Rivers State have advocated more stringent measures and upgrading of health facilities, especially isolation centers, and review of protocols put in place to contain the viral disease. As the country grapples with recovery of the attendant losses and hardship from the pandemic, it behoves on all to make efforts to combat the rising cases of coronavirus in the country.
We go to Lafia, Nasarawa State.
An index case in 2020 to more than 400 confirmed cases of coronavirus. Nasarawa State is said to have successfully treated and discharged all the patients, as there is no single COVID-19 patient in the isolation center. However, there is fear of possible upsurge as other countries of the world battle the second wave of the pandemic. Low level of compliance to social distancing, hand washing and the use of face masks, as well as poor response to testing by residents in the state are said to be some of the factors responsible for the resurgence of COVID-19. Stakeholders say proactive measures should be adopted to enforce compliance with COVID-19 protocols so as to prevent community transmission of the virus.
Just like they say social distancing, it will be very important for government to put measures to ensure such rules to be abided.
Just as these nose masks, for example, the shape by going to the to mix up with people, we should wear it to prevent us from the COVID-19.
Regular use of face mask, then regular washing of hands with application of sanitizers, then maintaining social distancing. I think if we sustain these guidelines, it will help to avert any possibility of lockdown hereafter.
The state government on its part says is bracing up for any possible upsurge of the pandemic. In addition to other measures put in place, government says the establishment of additional testing center in Lafia will boost capacity in the state.
What we do more now is more of enlightenment and education and contact tracing and what have you. And the good thing now is that within the state we can now do the test for COVID-19.
Benin is next.
Mr. Efosai Dugboy is a fish farmer in Benin City. He is yet to recover from the losses he suffered during months of lockdown.
Dollar went up and our feeds purchase procurements equally skyrocketed in terms of pricing. And in all this market volatility, you talk about the hoteliers, you talk about the barbecue centers, just name it, the market women. The middle men and women in the industry, you cannot sell, you cannot reach out.
Monday Iwe, like most fashion designers and Nigerians in the hospitality industry, also had their fair share of losses with the ban on social engagements.
With the event of coronavirus, it has affected us negatively because there's nothing like ceremony that have to, make our business go well.
However, while the lockdown lasted, efforts were made by the state government, private sector, individuals, and even the Oba of Benin to cushion the effect. Food items and facilities for hand washing were distributed in the state. With the threat of another lockdown owing to the rise in community transmission of the virus in some states, the state government says it has not let its guard down and is ready for any eventuality.
We are not praying for a second wave, but with the attitude of not wearing face masks and social distancing, when God forbid the second wave comes, it's going to be very, very fatal. So I want to use the opportunity to appeal to the general public to continue to practice social distancing and also wear face mask or any material you can use to cover your nose.
But citizens will not forget in a hurry the challenges of the lockdown. They want a revival in the practice of the safety guidelines pending when a vaccine is readily available.
Our last report on the program tonight is from Jigawa State.
It recorded its coronavirus pandemic index case April 19 this year in Kazori, the headquarters of Kazori Local Council, which shares boundary with Katsina State. This development led to the initial lockdown of the local government area for 7 days, from 12 midnight of 20th April, to facilitate contact tracing and subsequent admission of the patient at the Duse Isolation Center. Data by the Nigeria Center for Disease Control indicates that Jigawa State is currently standing at number 26 position on the nation's COVID-19 chart with 328 confirmed cases, 308 discharged patients, 9 active cases and 11 deaths after screening of about 2,500 samples. In Jigawa State, however, the pandemic is being transported by travelers going in and outside the state, largely because it shares boundary with 4 states border with Niger Republic. As precautionary measure against another possible wave of the dreaded virus, testing is continuing to detect carriers to curb local transmission. Towards handling any emergency, the main isolation center in Duse, equipped with necessary facilities and manned by trained health personnel, maintains 24/7 operations.
The second wave for COVID-19 is a possibility, and already globally it has started, and in some countries it's actually becoming very overwhelming. And I think for us, we have to take the necessary precautions.
Jigawa last recorded 1 COVID-19 infection on Sunday, 22nd of this month. This is coming as NTA News observed lackadaisical attitude on the part of the public in observing the COVID-19 protocols.
Right now, we have sample collection centers in all the 12 general hospitals in the state. We have also activated disease surveillance and notification in all the 27 local government areas. And as I speak to you now, we are doing sensitization of community leaders at ward level.
Our last report on the program tonight, but quickly before I go to Professor Nasidi, we have our first caller tonight. Mohammed is calling from Katsina. Hello, Mohammed.
Hello, good evening.
Good evening. Please go ahead.
Okay, thank you. I think this is a very, especially with the current situation, many countries, including there is a second wave of COVID-19. So there is absolute need for Nigeria also to prevent this resurgence. I think we need to set priorities. Number one is protecting people from becoming infected, which I believe the NCDC is doing very well in that. Number two is where the problem, I think, is protecting of those workers on the front line. Recently, there was an embarrassment. With respect to the Minister of Health, he was asked about the hazard allowance of the health workers on the front line that is taking care of these people that are infected. But unfortunately, he said he don't know. And he's in Nigeria, which is highly embarrassing. As a minister, you are not supposed to say you don't know the hazard allowance. And another problem with, and I can even sense it in the program now that you are doing, is we have Professor Nasidi, we have Dr. Sana Ali, we have Dr. John and others. What about the nurses? We have someone representing the nurses that are the infected people with COVID-19. Do we have someone representing that can speak about presentations, what is happening, with interaction with patients? Do we have? That is bias and indifference in the healthcare system of our country, which is very much affecting us. We need to change this. And may Allah subhanahu wa ta'ala continue to protect us from COVID. Thank you.
Thank you so much. Your line of thought is quite sticking. We appreciate that. Professor Nasidi, listening to one of the reports from, I think, was it Kaduna or Enugu? The reporter talked about NSAS, non-compliance by the youths, and discussing offsets. You had a trump card you wanted to sell to Nigerians. Can we quickly, briefly have that from you?
Well, I think just so to touch on some of my worries, I'm happy this came from one of the reports. One of the weakest points of our response is the effective engagement of the youth, because it is the youth that can spread the virus without actually falling serious victims of the disease, because they can tolerate the virus, they don't have the severe forms easily. So this is a virus that, moves through the youth to their elders. So if you don't engage the youth properly, you will miss the boat. So a good example is, during the NSAS, protest, the youth of the country revolted, and their voice was heard. Even the president had their voice. He agreed. He said they should listen to them. Let's engage them. Let's get, to hear what they are listening, and they will respond. But there was one thing that we were missing. And the fact was, when they were protesting, when they were reacting, they were also actually exposing themselves to another danger. And this is what, it was leading or could lead to the problems with our economy, because the disease, we can have an upsurge, and if you have such an upsurge, because we didn't engage the youth rightly, it's a big problem. So during that time of the NSAS campaign, nobody talked to them. And almost 90% of them were not wearing masks. There's big crowding, there was violence, then of course violence came in, not those who are protesting. So you have a super spreader event happening among the youth. So, and surprisingly, if you take what they are saying, NSAS, I have something here that will tell you what actual SARS is. I don't know if the camera can capture it. If you can capture it very well, you will see that SARS is actually severe acute respiratory syndrome. So the virus that causes the COVID-19 is called SARS-CoV-2. That is a severe acute respiratory syndrome virus, COVID virus type 2. So we should have used something like this, get the National Orientation Agency, empower them, Ministry of Information, empower them, it's like you are buying vaccine, actually. Engage the same youth to go the positive way. So for every negative, there could be positive, and for every positive, there could be negative. I think these are one of the few things we should be using. And engaging the youth, is to get them to talk to themselves. Say, oh, listen, we have listened to your protest, but please beware that there's something hanging around you too. You are also endangering yourself, to this, deadly virus that is here now, that is actually making us to lock down and affecting our economy. So what we are protesting against, we have to have strong economy to change all those SARS, this and so on and so forth, get SWAT, is it SWAT or whatever they call it, and so on and so forth. But at the same time, whatever you are doing, remember yourself that don't expose yourself to danger. There is danger there. So I'm sure Dr. Sani Aliyu of the PTF and the SGF, I'm happy anytime they have the PTF meeting, they always talk that there's this possibility that please don't think that it's all over and so on and so forth. But the real activities should now start focusing on risk communication. A lot of funds should now go to that area. Engage the youth, keep them busy, get them to talk to themselves, let them know that they are the vehicles through which this disease can spread into their parents, into their grandparents, and so on and so forth. So one of the best ways to protect, the disease is to talk to them and make sure that we have, the information coming to those who can carry the virus and not be sick. Because anybody above 50, 60, and we saw what happened in Italy, that the chances that somebody could die from this disease is about 80 to 100 times higher if you are between 65 to 80 and above than if you are just 20 to 40. And then secondly, unfortunately, is that the youth, even if they are in the severe stage and they are rushed to the healthcare facility and all this, they have a chance of struggling and surviving within 3 to 7 days. But I'm sure the records are there. Dr. Sani and Dr. Chikwe Hekwazu will have the information that in the African continent, our survival rate at the ICUs is so low. So more of our patients are dying in our ICU units, which are even very few. You see big cities, I don't want to mention, don't have more than 40 ICU units. Don't have more than 80 and so on and so forth. So can you imagine if, God forbid, Baton will have a second wave and we have now several cases like what happened all of a sudden in Lagos and Kano and other places, and we shall require 200, 500, 1,000 ICU units. You can imagine what is going to happen. So we have to emphasize a lot. We are not as rich as these other countries that can cope, but at the same time, if we spend a lot of resources now in reaching, those who spread this disease, we shall avert a lot of disaster.
So, John, quickly, quite disturbing there, but Dr. Liu and the DG of NCDC has assured that as much as we have gaps here and there, so much has been put in place to ensure that Nigeria does not slide into a second wave. But Dr. John, within the correlation of testing, vaccine discovery, and availability, all to avert a second wave, what will you say is your advice?
Well, my number one advice is, let me start by recapping what our President Muhammadu Buhari said in the first broadcast on the outbreak of this, disease in the country. He told us, reminded and warned sternly that every Nigerian should remember that your freedom ends where another person's right, begins. And that calls for a sense of responsibility from all of us by being in compliance with the non-pharmaceutical, interventions. And as we've always said over and over, these non-pharmaceutical interventions, vaccinations, but my message also is that we should also look at way of fortifying our bodies, that is our immune system, so that if the disease comes to us, we'll be able to survive. Professor Nasidi mentioned about the chances of the youth surviving attack or infection with COVID-19, that is the disease, is simply because scientifically, the youth and the immune system is much more stronger, especially the innate arm of the immune system. Let me stop there, just to say that the immune system is much, stronger. Why? Because the younger, generation or the youth have not exposed themselves to environmental insults that actually weakens our own immune system. The older people, persons, especially those with comorbidities, they have other underlying diseases. You see that once they are challenged with, the virus, they don't make it. So my appeal to Nigerians is that, first, let's remember what the president said. Even if you don't like yourself, you should be earnest enough, or you should be fair, that you will not get the disease and transmit it onto another person. It's their own right. It's your own, freedom, but it's their own right also to live. So this is very important, and even from moral point of view. So let's all take this very, very serious with the non-pharmaceutical interventions, making sure that we have an up and running, immune system, eating right, and supplementation. These are very important. And the government should not just also underlook this, but also help the people so that they can have a buoyant immune system. Increase, it is all about what you really take. Immune system, nutrition is what actually drives, our own immune system. If you're not eating properly, and then public education, this risk communication that we talk about. Make sure you rest very well, you sleep very well, you do the right thing, and live a moral life. This will help in building your immune system. Thank you.
Okay, quickly before we take our last thoughts, Dr. Aliyu, a couple of tweets came in here. I'll just read through them, and maybe you do a potpourri response to all of them. Quickly, Mohammed Major says, children must be provided with face masks and shields as well as hand sanitizers. Gift says, what is the testing capacity of Nigeria? Lawan says, in case another phase of COVID-19 comes, will there be palliatives? Emeka hope the federal government will use this to improve the health sector because it has been invested on, just like many other sectors of the economy. Maybe quickly respond to that.
So I hope my memory will not fail me because you've got 4 or 5 different things there.
Absolutely.
So the first one with the issue of the laboratory testing. So with the laboratory tests, yes, DG NCDC can correct me here, but I believe for quite a while we've had a capacity of more than 10,000 tests a day. We are now doing sometimes up to 4,000, but most times between 1,500 to 2,000 a day. So we still have excess capacity. There are labs that have opened that have not been testing for the last few weeks. They have not had any sample. The problem is the samples need to be taken in order for the labs to be active. So that's one. Secondly, the issue of will there be palliatives if there's a second wave? We've got to make sure there's no second wave. If we have a second wave and we lock up the country, the damage to our economy will be huge. It will be huge. And not only that, as you can see from what's happening in Europe, etc., there have been more deaths collectively now with the second wave than there have been in March for many countries. So let's not even start thinking of a second wave. Let's do whatever we can to stop a second wave from happening in this country. We all have collective responsibility, personal responsibility for our own health and for the health of our loved ones as well as our communities. We shouldn't play Russian roulette. We shouldn't be suicidal. We should also remember, if you are in the group, the vulnerable group, above the age of 50, your chances of dying with COVID, if you catch it in Nigeria, is very high. 23% of those above the age of 50 died. And not only that, even if you are young, the youngest person to die of COVID in Abuja for quite a while was just 39 years old. So this can affect you. We've got to stop stop this debate of, well, if there's a second wave, and just say we're going to work towards not having a second wave. We've got to do whatever we can so that we do not have to go back to the days of March, April of a lockdown. And nobody is interested in palliatives. It's better you go out and seek your own money and feed your family. That's more sustainable than you being given a bag of rice to look after. So that shouldn't even be an issue at all. Now, my memory is failing me, I'm afraid, because the other issue...
Health infrastructure.
Health infrastructure is so important. I'm very pleased the health budget...
Not just health infrastructure, you said if this will be a lesson to the authorities to ensure that the health infrastructure is put in place adequately.
So there will be spin-offs. As we know, there's always a silver lining in every cloud. We've realized that our health system is weak. We have been lucky this time around. We've got away pretty easily. We've got to be prepared for the next pandemic, because the next pandemic will come eventually, whether it's flu or whatever. We've got to be prepared. I'm pleased that the National Assembly has worked with the executive to have a better budget at the federal level for health. And some states, like Kaduna State, for instance, they are already achieving the target figure in terms of how much you budget for health. Not only that, even from the PTF side, working with the Federal Ministry of Finance, there's a plan to have an isolation treatment facility in every state. We're setting up molecular labs. We are also setting up ICU facilities. But we still have a very long way to go. And this is all, we've got to do this together, whether it's the public sector or it's the private sector. And we hope that the engagement, the very positive engagement we've had with COVID, our donor partners and other parts of the private sector will continue, so that they continue to support government. Government cannot do everything. It's impossible for government to fund every single aspect of health. But together we can, I'm sure we can have a better future, a healthier future for our country.
Okay, let me quickly go to Professor Nasidi and Dr. John. Professor Nasidi, beginning with you, Dr. Liu has just said here that we should not even contemplate a second wave. So, just your last words to those Nigerians apparently who are very, 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 very impervious to appeals to comply and respond to the safety protocols.
Well, thank you very much. Before I appeal to Nigerians, I would like to appeal to Nigerian government. I agree that government alone can't do it. We have to come with the private partners and other partners and the populace. We don't want second wave, but unfortunately, we can't predict and determine when it will come or whether it will come or not. So the best solution is wake up, do the right thing, and get it. Either when it comes, the impact is mitigated. So, and some of the few things that we believe that could be done is, one, protect the healthcare workers, protect the populace, be ready, empower the Federal Ministry of Health to buy vaccines, get vaccines. We shouldn't wait for only WHO decent plans. I'm saying this because countries with large populations should not joke. We shouldn't joke at all. We should have our own, stockpile of vaccines and, therapeutics that can really help us to mitigate the impact of the second wave. My last appeal to every Nigerian is exactly what my brother here, John, said, that, don't wait for the snake to come under your feet. Wear the boot and protect yourself. Please don't just say it's not here, it's gone. We are seeing fire in our neighboring countries, in our neighboring houses. Just every Nigerian should look for the water that he will use to quench the fire if it comes to his house. Don't be a fool. Please protect yourself. This thing is real. The virus is still going around. We have evidence, and I want to say it here categorically, that some of the deaths that we are thinking are non-COVID, are really COVID. We have evidence that there's what we call cross-reactivity in Africa, and that's why the cases are a bit less. That is, they were carrying some viruses that could give us cross-protection. Therefore, the clinical presentation in Africa might not be as typical as we are thinking. So some of the diseases we are thinking are just common diseases, malaria, typhoid, etc., could actually, be coming in form of COVID. So don't take anything for granted. My dear Nigerians, please look for your mask. Look for your hand sanitizer. Keep social and physical contact distancing. Distancing. And please listen to the experts. Thank you very much.
Okay, Dr. John, it will be said, what best time? The time is now. And you have always emphasized on the need for people to build their immunity. I remember years back, we hear about this immunization, the bodyguard that protects the children from the child killer disease. So your last word?
Well, let me use this opportunity also to appeal to Nigerians. An American general once said, the best way to avoid a war is to be prepared. If you are prepared, if the enemy comes, whether by air, your air force will be there. Whether by the sea, your navy will be there. And whether by land, your infantry is there. So let's not rest on our laurels. Be prepared. And the best way to be prepared is to do the non-pharmaceutical interventions. And again, as I've always emphasized, make sure your immune system is prepared to face the enemy, whether he comes by air, by land, or by sea, and in this case, by way of SARS-CoV-2 virus that manifests in the form of the disease COVID-19. I hope all Nigerians will take this, very seriously. If we don't take care of ourselves, as I always tell, patients when I have the opportunity to interact with them, I say that your health is one area where you have to exhibit the highest level of, selfishness. If you don't take care of your health, nobody will take it for you. And may God help us.
Thank you so much, Dr. John Toagbide and Professor Abdulsalami Nasiri. It was having you on Tuesday Live tonight. Thank you so much. And back here, Dr. Aliyu, let me just give you the opportunity to just a snippet of one word as we wrap up the program tonight.
Thank you, Amini. 3 messages.
Okay.
1, to those that are outside the country or those intending to travel outside the country, please stay put. 2, for the state governors, please let us work together. Make sure that your body language is very clear. You should provide the right messages to your communities, but more importantly, the money we have given you, please release it for the purpose it was meant for. Thirdly, to the general public, let us be our brothers' keepers and our sisters as well. This thing has not gone away, and it is still a risk. We don't want to go back to the days of March, April. Let us stop playing with our lives by pretending that this is over and make sure that we implement those non-pharmaceutical interventions. It is not yet time to remove our mask. It is not yet time to embrace ourselves and be shaking our hands and pretending that this is over. Let us please comply with our non-pharmaceutical interventions. When it is over, we will let you know. Thank you.
Thank you so much, Dr. Aliyu, National Coordinator, Presidential Task Force on COVID-19. That's it on the program. Thank you so much for your tweets. Thank you for your calls. And on behalf of all of us, keep safe and take responsibility. COVID-19 is real. Thanks for watching.